Good morning, everybody. Welcome to another Mancoll Minute, first of 2020. I hope you had a great New Year, holiday season, and all revved up, getting ready for the upcoming wonderful things that life has to offer. Well, things are busy here because, as you would imagine, kind of after the first of the year, we start getting a lot of phone calls. People are planning on spring and summertime and looking to get that new body and sort of get back in shape and back in the contour they're looking for. So I thought I'd take a minute to talk about sort of how can I help people kind of achieve those goals? How can I have them, help them see what they're going to look like, or at least have a goal in mind? So a number of years ago, I brought in a piece of technology called the Vectra. And what you see right here is the Vectra 3D imaging camera. And it's this really cool picture. You go to any plastic surgeon's office, they're going to take a picture of you, put it in your file. But with this picture, I'm actually going to take your picture in 3D, and now I can manipulate it, and I can kind of show you changes that I think are realistic, reasonable changes, and set expectations. So I just kind of randomly picked a picture out of here. You stand in front of it, it's got 6 cameras, the flash, then it processes the images. My nurses do that, and then I kind of come over to the computer and I say, okay, here we go. What don't we like? We've got some boxiness, we've got some wrinkles, we don't have great shape through here. So I can start coming in with my mouse and start thinking like I think in surgery. Okay, I'm start making changes that I know are reasonable to do. So in this case, this represents all the areas that I'd be doing liposuction under, where I'm now starting to get that lower back swell, that lower back contour. I go back over to the sides here, and I'm going to kind of fine tune where I'm going to take down a little bit of here, but you know what, I might want to add a little bit of fat here, depending on what the patient's looking for. We're now starting to see that shape develop, as you can kind of compare to this boxiness on the other side. At the same time, if I go on the side profile, that's not bad, but I know there's a big fat pocket right here. So I can further come in here and I can do lipo, where I come in, and now even though she's got some black panties on, you can see how we're now creating that swell in the back, and without really doing anything else to adding to the buttock, how much more definition we're getting back here. And if they say, gosh, I really wish this weren't quite so flat here, we can just take a little bit of fat and do a little fat grafting, and we can kind of pop that out. If I go back on the 3/4 view, we can see we're kind of flat through here. I can add a little more fat through here. And we're just kind of popping this out to continue to give better shape and contour. So when we're all done, I'm showing what I would say is a more realistic expectation. So when the patient says to me, I'm not really sure if this is going to give me what I'm looking for, we're sort of looking at what I think is reasonable to achieve. Now, of course, I always tell them the computer doesn't do a great job of getting rid of these lines, but that's something that will actually markedly improve for virtually everybody. So to me, it's a great education tool. I think it helps set realistic expectations for folks, and in many, many cases, their outcomes are virtually what you see on the screen here. So I think it's also a wonderful way for me to kind of highlight what I can do, and have happy patients when it's all said and done. So if you're interested in kind of seeing what's the possibilities for you, come in, make an appointment with Teresa. We can kind of go over what you're looking for, whether the visit, the Vectra can help me identify for you treatment areas, or at least what we can do is talk about how to take care of those problems for you. Talking about recovery, return to work, all that stuff, that's all part of the conversation we have after the fact. But let's start with kind of what you're looking for. Come in with your laundry list, and let's see what we can't do. So have a great day, have a great weekend, and I'll talk to you next week.